Hi, my name is Melody, and I'm going to be talking about the pain assessment in the cognitively impaired. This is a qualitative article review. The title of the article I will be critiquing is Pain in Communication Impaired Residents with Dementia, Analysis of the Resident Assessment Instrument, RAI Data, by Carrie A. Brown. This article appears in the August 2010, Volume 9, Number 3 issue of Dementia, the International Journal of Social Research and Practice. The author, Carrie Brown, is an associate professor in the Department of Occupational Therapy, Faculty of Medical Rehabilitation at the University of Alberta, Canada. She and her research team have published and presented a number of scientific papers in these areas in both multidisciplinary and international forums. So this is the abstract of the article. The background states pain has been identified as a significant and underreported problem in the older adults and those persons with dementia who may face an impaired ability to communicate that they are in pain. Their pain, underdiagnosed and undertreated, has functional implications such as decreased ambulation, mood and sleep disturbances, impaired appetite, and exacerbation of cognitive functioning. Methods. Resident Assessment Instrument, RAI data were analyzed in order to 1. Identify a pain profile of all the residents living in the facility across 2 sampling periods, December 2005 through December 2006, and 2. To compare the pain profile of residents categorized into 2 subgroups, intact communication and impaired communication. Findings consistent with literature, clear differences were demonstrated between pain reporting and management for communication impaired residents with dementia and residents with intact communication. Several incongruent findings were also demonstrated. Conclusions. The RAI is useful to identify patterns, but insufficient in itself for pain management purposes in this vulnerable group. Pain assessment tools developed for this population must be employed. Qualitative research. The problem statement. Persons with dementia who may face impaired ability to communicate that they are in pain and underdiagnosed and undertreated for pain. Purpose and research questions. Resident assessment instrument data were analyzed to identify pain and compare the pain profile with 2 subgroups, intact communication and impaired communication. Literature review. Qualitative research. Dr. Brown references 40 different publication journals to support her article. Sampling and sample. Residents living in facility were analyzed, 189 people in a 12-month period. Predominantly female, 70.1% that were 90 years of age and older. Data collection. Resident assessment instrument used to assess the health, functional, and psychosocial needs and abilities of long-term care residents. Pain-specific items in the RAI: intensity, frequency, and location. Protecting human participants. Participants sign consents for participation in study. Data management and analysis. Analyzed effects of RAI data with residents able to report pain and residents cognitively impaired, unable to report pain. Finding and discussion. RAI may be helpful with patients that can report pain, but another assessment should be used to assess patients who are unable to verbally report pain. Strengths and weaknesses. This study presents a reflective statistical analysis of RAI data for a residential continuing care facility in a large Canadian urban setting. This analysis aims to 1. Identify a pain profile for all the residents living in the facility across 2 sampling periods, December 2005 and December 2006. And 2. Compare the pain profile of the sample of residents categorized into 2 subgroups, those residents with intact communication and those with impaired communication, in order to determine if there are variations that may highlight the need for alternate assessment and management strategies. There were records for 189 persons residing in the facility over the course of 12 months. Deaths and new admissions for the unit were very high, and only 97 people, 51.3%, were in residence across both sampling periods. These 97 residents were predominantly female, 70.1%, and 33.9% were 90 years of age and older. Evidence and research bias. Several possible explanations for the discrepancies in findings are that different staffing patterns make it more or less likely for staff to witness certain behaviors. Staff interpret aggressive behaviors differently dependent on personal beliefs and experiences. Tolerance and non-reporting of aggression may be linked to the institutional culture. Some centers have heightened awareness amongst staff as a result of in-service training, and certain facilities may have more effective behavioral management strategies in place that result in reduced incidents of aggression among residents. Ethical and legal concerns related to the protection of human subjects in research and informatics. Following approval of the researchers' university and regional health authorities' ethics board, anonymous archived resident assessment data 2.0 data was provided by the regional health agency responsible for the sample county continuing care facility. The research was not involved in data collection beyond selecting a site that had several years of experience with collecting RAI data and had no access to specific information about who completed the RAI assessments beyond the care facility policy that assessors received the training in administering this assessment. Patient group participants signed an informed consent. Relationship among theory, practice, and research. In theory, there is clear evidence that pain is underreported and undertreated in persons with dementia. In practice, there are no studies of how the growing use of resident assessment instrument as a routine and repeated assessment of health, functional, and psychosocial needs and abilities of long-term care residents sufficiently captures the pain experience of continuing care residents. In research, the global population is aging, and consequent to this longevity, people may frequently experience multiple chronic illnesses, many of which have pain as a persistent symptoms. The concerns of elderly people with dementia and chronic pain are of relevance, where the percentage of the population over 65 years of age is expected to reach between 17.5 and 36.3% by 2020. The critical issue for people with dementia is impaired ability to communicate their pain. Nurses' role. Nurses play an important role in implementing and disseminating research. Dissemination is the mechanism and strategies by which specific groups become aware of, obtain, and make use of information. Effective dissemination can support staff to share information about developments in healthcare practice and help services adopt and implement innovation. In addition, dissemination is a key process in evidence-based practice, enabling healthcare staff to make decisions based on quality information regarding the effectiveness and cost-effectiveness of proposed healthcare interventions. Action research stands a greater chance of being implemented because it is carried out in line with local needs and issues, encourages full involvement of staff, and permits change throughout the process of project work. Academics working across organizations can help support change and provide support for clinicians to interpret findings and consider how to implement any changes in practice. How the study provides evidence for evidence-based practice. Firstly, analysis of RAI data can successfully identify issues that have been emerged with overwhelming frequency in the literature related to the underreporting and probable undertreatment of pain in people who are unable to reliably self-report. Secondly, this analysis has provided objective support for the initiatives currently underway in many continuing care organizations to provide education and skills development, enabling staff to better recognize the management and manage the need of people with pain. The RAI should not be seen as sufficient in itself to guide pain management in persons with barriers like dementia to reliable self-report. In conclusion, pain in this vulnerable population is dependent on careful observation and interpretation of changes in behavior. As the population with dementia continues to grow, It is important that we avoid accepting a one-size-fits-all approach to long-term health care monitoring, that we support the continued development of tools to address the issues related to pain and pain expression. And there are my references. Thank you.